Hello, everyone. My name is John Tahido. For those of you who don't know me, I'm the physician in charge of the Research and Academics Committee, and I would like to give a short update on our activities over the past 6 months. And so the objectives will first be to talk about the published work we've had during the past 6 months. Keep in mind that any and all publications end up having emergency medicine specialists listed as an affiliation, which will help um, uh, kind of increase the um, spread the name EMS, emergency medicine specialists, both nationwide and worldwide, so people can see the research that we're working on. I'm then going to talk about some manuscript reviews that we've done over the past 6 months. So we are often asked by scholarly journals to review and critically appraise a manuscript to determine if it would be fit and well written for publication. And so we have been continuing to do that. I then will talk about some manuscripts being considered by scholarly journals and present upcoming projects. This is a manuscript that Dr. Fine, myself, and Joseph Honrath, who is a medical student, introduced to me by Dr. Mikowski. We wrote up this case report and got it published in the Canadian Journal of Emergency Medicine. It's an interesting case with the ultimate diagnosis being reversible cerebral vasoconstriction syndrome. This was a manuscript review that we did, specifically myself, Dr. Fine, and Matthew Treat. We reviewed this manuscript for the Journal of Emergency Medicine, critically appraised it, and provided our recommendations for publication and any edits that we felt were necessary. This is a study looking at a age-adjusted shock index as a predictor for hospital admission among pediatric patients, and it's a retrospective chart review. We also critically appraised this case report for the Journal of Emergency Medicine. This is a case report about a rare cause of headache in the emergency department. Turns out this patient actually had a congenital intracranial dermoid cyst that had been gradually enlarging over time and had really been asymptomatic for most of her life until she was 23 years old, started having headaches, and had an acute presentation to the emergency department requiring acute surgical intervention due to mass effect and herniation. This is a survey study that was carried out and data collected by the EMBC organization, and they asked me to write it up and see if we can get it published. Surveys can be particularly challenging to publish because they are inherently very biased. However, we thankfully were able to get it published in the National Journal of Emergency Medicine. Dr. Maurer, Lisa Maurer, is listed as one of the authors who was involved, and essentially, in short, this is a cross-sectional survey study that quantifies and compares group practice characteristics like emergency department quality metrics, physician caliber, physician involvement in the community, physician involvement in their hospital and hospital system, and it compares between physician-led democratic emergency medicine practice groups and a large nationwide performance measure report that looks at really all-comer emergency departments and emergency medicine groups. The case report here, we got accepted also in the Canadian Journal of Emergency Medicine. Dr. Fine, Matthew Treat, and Becca Walsh worked with me to write up this case report, which was very interesting. Happened at Franklin, of a young man who came in with acute onset altered mental status, seizures, ultimately diagnosed with pituitary apoplexy, which means the pituitary gland had been enlarging due to a mass. Ultimately the enlargement does come with risks of acute bleeding into the mass, whether it's due to the mass outgrowing its blood supply and becoming necrotic and friable, or just disorganized blood vessel formation. Regardless, it bled into the mass, caused a mass effect and herniation, as well as severe hyponatremia, leading to both of which probably contributed to a seizure event. And the patient also required acute surgical intervention and had a very good outcome. This is this is actually a case series that we got published, myself as well as Matthew Treat, looked at the greater palatine foramen injection with epinephrine as an adjunctive treatment for epistaxis, and we did a case series on this. The greater palatine foramen block is a commonly used block for dental anesthesia prior to simple dental procedures. The greater palatine artery, which feeds much of the blood flow to the nasal septum, runs through the greater palatine foramen, and therefore injecting the area with something like lidocaine with epinephrine may help vasoconstrict that artery and decrease blood flow to the nasal septum, which may help slow anterior epistaxis and be an additional adjunctive treatment option. This actually has been published once before, and there's also a systematic review and meta-analysis, somewhat unrelated but still relevant, where ENT physicians use this procedure to help manage perioperative bleeding and postoperative bleeding after endoscopic sinus surgery. And so therefore this may be an additional option that should be studied more, but this is a good hypothesis generating case series of this procedure that we used to help manage a few cases of epistaxis. And this is published in the American Journal of Emergency Medicine. We have a few retrospective studies here that are still being considered for publication. These sometimes take longer to get published because there's a more robust review process. It's not a simple case report. The methods and statistical analysis undergo quite a bit of scrutiny, and so it does take longer for these to get published. We have had one of these published previously that looked at some data regarding waiting room medicine, but they again takes a little bit longer for journals to review these. One of them is looking at TXA use in acute undifferentiated angioedema. This study was, I had Matthew Treat helped with this chart review. Jeff Yoakum, the pharmacist at St. Joe's, helped, and so he's listed as an author as well. We have a medical student named Austin Tubbs, who was introduced to me by Dr. Peterson. He was involved and listed as an author. We have another study, a retrospective analysis of dialysis patients presenting to the emergency department with bleeding or AV fistulas or grafts. This study, Heidi Toth helped a lot with this retrospective review, so both of these are being considered in the listed journals for publication. And we have some ongoing projects. So we're looking at one thing we are looking at is a retrospective study for stool occult blood test to see how useful it is in determining either as a diagnostic tool or diagnostic aid for clinically important GI bleeding in the emergency department specifically. The guaiac test itself really was originally developed for colon cancer screening purposes and has a fair amount of false positive and false negative tests that can or results that can happen with it, and so we're looking at test characteristics. This is being reviewed by the Ascension IRB as we speak, and I have Heidi Toth is going to be involved as well as definitely one resident, likely a second resident, that were introduced to me by Dr. Makowski. So it's good to see people from multiple um, uh, levels of education and multiple specialties, pharmacists, physician assistants, medical students, residents, getting involved in our research really helps create a really collaborative environment. Dr. Benson also uh, really, uh, somehow gets a lot of really interesting cases that come across her desk when she's working, and thankfully she saves them and has sent a few of them to me. She's a really interesting one that's a high pressure injection injury case that I'd like to write up. Um, I got another submitted very interesting case from Matthew Treat as well as Trent that I'd like to look into writing up, and I'll be getting on these soon once we get the stool occult blood test up and running. So just have to finish getting that through the Ascension IRB. And that's pretty much it. So if you have any questions, feel free to contact me. And thank you very much for your time.